We are going to be talking about getting back to work, proven approach for mitigating COVID-19 risks for employees and customers. Very timely topic. I'm the CEO of FusionCell, and Mike Klingstrom is Director of Consulting for FusionCell as well. So we're going to go through a little bit of who we are. We're going to talk about the impacts of COVID in the workplace, the science and the challenges of COVID. And then we're going to talk about the COVID Big Six, which is kind of our lens and approach for how you attack it, especially in a workforce, and layer in different levels of risk mitigation. Well, there'll be some final thoughts, and then, as we said, we'll have a chance to do some Q&A towards the end. A little bit about FusionCell. FusionCell's been around for about 3 years now with a primary focus of harnessing veteran talent and delivering it to civilian companies. So we do it across multiple verticals. We do it for anywhere from startup companies to Fortune 500. We do it across different areas like cybersecurity, intelligence, IT, a lot of engineers and technicians, operators and logistics, professional services. We've done healthcare, public safety, business leaders. There are over 7,000 military occupations that exist. And in essence, the main goal of the company is to harness those different skill sets, those different competencies developed while these men and women are in service, and bring them to great companies across the country. It's been our primary focus, both permanent staffing as well as temporary. But we also have a bevy of services that we refer to as specialty services. And these are the ones that we're not just delivering talent to our partners in our companies, but we're solving problems as well. We're coming in, we're doing assessments, we're putting protocols together, a lot of it in the cyber and the physical area for security. We also help companies with organizational veteran readiness. How well do you attract, retain, and develop veterans within your diversity protocols? And we also help companies set up DoD, Department of Defense internships as well. You'll notice on here, virus pandemic risk mitigation is on here for specialty services, specifically COVID-19. I'll be perfectly honest with you, it was not prior to March. So just a little bit of a history on how we even got into this business. I think many of you, probably like myself, will always remember St. Patrick's Day 2020 rather, March 17th. It wasn't a great day. As a New Englander, it was a terrible day because we lost Tom Brady. The Dunkin' Donuts closed. Most of the bars were closed, and a lot of us who have children, myself, 4 of them, realized that they wouldn't be going back to school anytime soon. So on our team meeting that day, and our team comprises of mostly veteran recruiters, 20+ experience across the country, a lot of them from the Air Force. As a group, we talked about how our clients were probably going to be going into some level of pause for the next couple of weeks, and for not really knowing how long in regards to their hiring. And we talked about what are the other unique things that are done in the military, unique competencies in the military that could translate into what might be needed right now in this new kind of COVID-19 world. And without pause, the answer was emergency management. And as a civilian, my first comment was, "What's that?" And the team explained to me how every base forever will have a virus outbreak, disease outbreak, pandemic operation plan. And that plan is built by these emergency managers. They're the ones who oversee the implementation of them. But these emergency managers are also the ones that are sent overseas to deal with real world, real life pandemics, like SARS, Ebola, H1N1. So not only they have the expertise, but they have the experience with the disease as well. So right away, I asked if we could pull a team of these sort of folks together. And we got going on it pretty much immediately. And we found that we could. And we found that the military across all branches had deep experience in dealing with these exact sort of scenarios. So I'm going to introduce you to our lead expert for today and at FusionCell, Mike Klingstrom. He's going to tell you a little bit about his background. We're going to tell you kind of how this offering has evolved. You're on mute still, Mike. There you go.
Thanks, Matt. So my background was pharmacology, and I learned right as I was about to graduate that that's not the course that I wanted to take in life. I know I can count to 100, and I didn't have to prove it multiple times a day. So I found an Air Force recruiter, and he asked me if I wanted to be an epidemiologist and a public health officer. And I said, absolutely. After that interaction, I figured out what all that meant. And it was the course of action I never knew that I wanted to take. So after that, I got a full ride scholarship. I've got my master's in public health, in epidemiology, a graduate certificate in biostatistics. I've kept up my board certification in public health for the last 9 years. And I just transitioned out of the US Air Force after 10 years of active duty. And in that time, my main focus was pandemic planning, disease containment, but then also how to break that chain of infection, no matter what the infection was. And so making sure that people were safe and could go back to work has been a huge impact with the DoD, especially in deployed locations where you don't have a lot of people sitting around ready to come into work that day. So as I transitioned out, I got to touch a lot of different pieces of the Air Force. One was setting up Task Force COVID, so making sure that we planned appropriately so that if the Department of Defense had to go out and support a local area, that we could effectively bring people and stuff in. Second to that, I was the COVID disease manager for all the Air Force bases in the Middle East. So as I was transitioning out, I got the chance and the opportunity to plan with all those folks and work with their Department of State counterparts just to make sure that everything we were putting in place was supported by those host nations. And then as I transitioned out and started up with Fusion Cell, we jumped right into COVID planning. So it translated right away. And we have been with 12 different schools and businesses throughout the continental United States so far, and one in the Bahamas. So it's been fun and it's been a challenge, but it's worthwhile and I love it.
Thanks, Mike. So we quickly transitioned from assembling this team to engaging with different companies and different schools as well, which became a very a quick spot for us because it was so timely for them. And if you look at the things that we were able to pull together and the uniqueness within the marketplace, for sure the experience was there, and Mike just talked about it, right? These folks have board certified public health expertise. They're certified, backgrounds in epidemiology, pharmaceutical sciences, biostats, all the buzzwords that you were hearing as March and April rolled along, industrial hygiene background, HR as well. But the one area that was a big differentiator, I think, in this team that's been pulled together was the word experience. So there's a lot of people that can speak to expertise, but with the military, you actually have folks who've actually done it before. Infectious disease control, pandemic operations. I mentioned earlier, H1N1, SARS, Ebola are 3 real-world pandemics that these folks have been deployed at overseas with the job of containing them and developing strategies to have environments that can be operated safely and within a pandemic world. Very experienced in dealing with agencies like FEMA, Health and Human Services, FDA, OSHA as well. So the majority of what we started to do over the course of the summer continue to. One is the assessment, the readiness assessments. So each organization may be at a different spot when it comes to how are we going to deal with COVID within our walls, within our workforce, when our workforce goes outside the walls. We've come in and helped build them from scratch. We've come in and looked over your shoulder while companies are building them. We've also pointed out areas where it might want to be beefed up. Areas where maybe you're going a little bit too deep. So different variations of these projects we've done. At the end of the day, we help endorse the things that these companies are doing, feel confident about them, and also give confidence to the workforce that might be returning back, into the office at that particular time. In the on-call advice, this is something that's morphed on that once these programs and projects have been delivered, most of the clients continue to keep us on kind of speed dial, because the disease profile continues to change, but so do the elements within the company. So that's been a big part of what we've been doing as well. If you take a look at what the team might end up being, depending on your organization and what you might have from a requirement standpoint, public health specialists for sure, logistics, supply chain, civil engineering in the event where there are physical alterations that need to be made, international health specialists. We're dealing with an airport right now, for instance. We did a high school that was in the Bahamas. Emergency management specialists for sure, and obviously these bioenvironmental engineers, which help a lot with HVAC and other those sort of areas. we've been really busy. It's been a busy summer, Mike will tell you. And I will thank him because for the first half of it, he was still working active duty for the Air Force and doing this in sleepless nights with also a baby that was born halfway through it. So a lot of schools in the New England area, and that kind of came with them really speeding to open in the fall. And I will say out of the 7 or 8 schools we work with, they are all, knock on wood, still open, some boarding schools as well. A lot of businesses in New Hampshire, the airport we're working with as well. And we do see a trend that as we get closer to January of 2021 in the spring as well, companies and businesses are starting to get a little bit more serious about their planning and where they're at and where they're going to be at. This is just a quick little picture. A lot of the companies, when we first engage and we first get on the phone, when we ask, how are you addressing COVID and how are you addressing it within your environment? This was kind of the answer we were starting to get. It was Kathy, right, VP of Human Resources, or somebody in operations, or the chief people officer, or somebody in the HR department. So what a lot of companies were forced to do and are still forced to do, they're taking some of their best and brightest folks from within the company and they're pulling them together on this COVID-19 task force. So the challenge there is that we're yet to find anyone on these task force that have any experience with dealing with a pandemic. The other challenge is most of the folks on this team have really important jobs at the company that didn't become any less important because COVID broke out. So there's an erosion of productivity that tends to happen there as well. So what we've been able to do with some of these companies, obviously, is kind of be their conscience, be their go-to expert, and really kind of help them navigate through what has become a pretty complicated world with an attempt to try and get people back to the office. We're going to do a quick poll right now, and I'm going to throw it out here. There's 2 of them. I'm going to give about 30 seconds for each, and if you guys could throw an answer in, I'd appreciate it. And we're going to track these as we go. So I'm going to give about 15 to 20 seconds for this first one. All right, so it looks like we got just about everybody for the have you return to work. So thank you for that. And I'm going to launch the second one here. Just see here. Question number 2. And this one is, how prepared is your business? So again, we'll give it a couple seconds here. These are all anonymous. All right. So thank you for that. So the impact of COVID-19 in the workplace. And I'm going to walk through this a little bit and then we'll move on to Mike. So if you look at a timeline, again, early March, things were operating in what was pretty much a normal world. And then, it happened at different times for different companies. Last week of February, first week of March, second week of March, it quickly moved into emergency mode. COVID task force were pulled together towards the end of February or into early March. Companies pretty quickly came to the realization that work from home was going to be a quick and only solution, and everybody got sent there. So since then, companies have been operating in kind of this gray area, and different companies are in different places there. And there's been impacts that have been seen. Productivity erosion has been an issue for a lot of companies, right? That's one of the big ones that we've been hearing from our clients. There was a certain period of time where maybe there was a bump, And then over time, that productivity starts to erode. And again, it's different for every business and different functions within the business. Remote work fatigue is another big one that we hear from the companies that we talk to right now. There's only so long that that kitchen table can continue to be a good office for a lot of folks. You have unique situations at home. You have kids that are going from being in school to being in the house. Wi-Fi networks at home. There's a whole litany of things that can make working from home very difficult, dynamics socially, many different pieces to that for sure. A lot of functions that just don't work in a work from home environment. We see that in manufacturing worlds, certain administrative roles, certain finance roles, roles that require a high level of collaboration. There are tools that certainly can help bridge that gap, but there are others that it just doesn't translate. Infrastructure vulnerabilities is another big one as well. We've seen this with a lot of companies, a rise in cyber attacks, so on and so forth, an attack on company networks. And staff, employee, and patron fear just in general. A lot of employees have made it clear that they don't want to go back, that they don't feel comfortable doing so. That the thing keeping them from going there is whether it's their own potential disposition towards pre-existing conditions, whether it's somebody that's in their household. So there's a lot of folks that will find themselves in that, in that picture as well. So I'm gonna kind of give it over to Mike at this point, the more in-house resident expert here, to talk about why this problem is so hard to solve and really the disease profile that really pushes that.
Thanks, Matt. Can you advance? Thanks. One more. So COVID, when you talk about COVID in a work environment, really you have to define what the risk is. What is the problem? Specifically with work environments and coming back to an office, you have population density. So having crowded areas is never a good thing, especially with something that transmits from person to person. As you are coming back into a work environment, there's always that need for social interaction. So people tend to get a little bit closer. And if you ask people what 6 feet looks like, typically the answer you get is more around 4.5 feet. So the perception of being at 6 feet is not always the reality. But then without proper mitigations to the indoor and enclosed space and time as a factor, you can really increase the risk in an office. And that risk is substantial for some populations. So the middle of this slide talks about some of those comorbidities or underlying conditions that put people at greater risk for hospitalization and adverse outcomes. But there are ways to reduce the risk of COVID-19. And so the action here is how do we break that chain of infection? So COVID-19, the virus profile challenges, there's a lot of them. The main challenge is the infection itself. So you have pre-symptomatic people that are infectious, but not yet showing signs and symptoms. You have asymptomatic people that will never become sick. They won't have those signs and symptoms, but they are infectious to others. You have the fact that it spreads easily when there are a lot of people around, especially when you're inside. So the risk increases indoors without proper mitigation. Complacency, and I'm guilty of this. I leave my house without a mask probably once a day, but I have extra masks in my car because I know it's gonna happen. But we've been in this for 200+ days, and it's one of those things where people just get tired, and you want to go back to that old normal, not the new normal. You have confusing messages. So you have the political science, especially during a election season, but it sometimes conflicts with the actual science, and the attacks within the organizations that are putting out some of the recommendations, it just takes away and undermines some of that credibility. So who do you look for when you're looking for guidance, and what does that guidance look like? And it definitely changes, that's for sure. So if you think about the spectrum of guidance that an office or a building, a business might be subject to, it's everything from your city, your local area, It can go up to the state, which has your safer at home, but also your stay at home 2.0. You also have the Department of Health and Human Services. As you go up to the federal level, you get into the CDC, and if you're going to have business essential travel, Department of Homeland Security and TSA, places that you're going to have to go through. And they all have their own different, unique regulations. And then it gets confusing as you talk about the noise. So the news outlets, social media, they all play a part of this. But if you can focus your attention to the middle of the slide, what it all revolves around is the scientific publications that are out there. The New England Journal of Medicine, other publications throughout the world that have been utilized as we progress through COVID-19 to really put out data and observations and tests that have been going on to try to define the problem a little bit more every single day, which is why that guidance changes. And sometimes it changes daily. Sometimes it takes a little bit to catch up. But as we learn more, the guidance will change. So it definitely adds another layer in there. But as you define what you're going to do, you really have to focus in on what is the lens that you're looking through. So remember that a close contact is being within 6 feet of somebody who is confirmed or suspected of COVID-19 within the 2 days prior to symptom onset. And this is one of those conflicting areas. So the CDC says 15 minutes of cumulative time over those 2 days. In the state of New Hampshire, they say 10 minutes. So anything over 10 minutes. And it's not inappropriate to go more restrictive. It actually helps take people out of population that would otherwise become sick. So you see some guidance that is different at different levels, but really the common terms that are out there that sometimes get interchanged inappropriately in the media are isolation and quarantine. So isolation is taking somebody who's sick and removing them from the population. So that exclusion criteria, making sure that they stay at home, that they have the support they need so they don't have to go out. There is an ability to test out of isolation. So if I'm sick, I have runny nose and I'm coughing, I can get a flu test and a COVID test. If my flu test comes back positive, my COVID test comes back negative, they may just say it's flu. Follow the return to work guidance for influenza and then go back. If it's COVID, you're out for 10 days. For quarantine, so this is what happens for a close contact. Quarantine, you are excluded for 14 days and you cannot test out of quarantine. It's really a 14-day observation period to see if you're going to develop signs and symptoms based on that close contact criteria. Both of these work hand in hand to keep the healthiest group of people in the population and reduce that risk of spread as much as possible. So how do you attack COVID-19? There's a lot of things that are out there. There's, like we said, there's conflicting guidance, but it all comes back to the lens of science. And for most viral respiratory transmission diseases, there's really 6 steps, 6 areas that you can focus on to reduce that risk significantly. And so the very first thing, knowing that it's your coughs, your respiratory droplets that are out there, your HVAC system within your space is going to be critical. Air is your #1 route of exposure. So if you can upgrade your HVAC filters so that your central air is effective at filtering out COVID, you're really doing yourself a huge service. After that, you can increase the amount of fresh air to the maximum amount. I know as you get into winter months, your system may not support 100% fresh air coming in. It might not be able to keep up with the heating demands for those specific spaces, but you really want to increase the fresh air intake as much as possible. Fresh air does a lot of things, but really it dilutes what's already inside of the environment. If you can open windows, based on other factors, you're going to increase fresh air that's coming into the space. Open windows, open doors. HEPA filters are effective against COVID, but there's different levels of HEPA filtration. So you have HEPA filters that are effective against droplets, and you have HEPA filters that are effective against airborne pathogens. As you think about, as you move from the air, you think about the things that people are touching. So you talk about sanitation. So you have to be cleaning with things that are effective to disinfect COVID-19 that's on a surface, whether it's a door handle, a coffee pot, something in a common space. You really have to be effective. And that's where the EPA list N comes into play. Now, if you just pull all the products that are on there, you will get 25 products per page and about 150 pages worth of products. So there's quite a few products on the market that are effective against COVID-19. But they all have different properties, they have different chemical compounds, and they have different safety hazards, as well as times that it takes to be effective against COVID-19. So as you are weighing your time, you might see a product that has a 1-minute kill time, and that's great. You might see a product that has a 10-minute kill time, and for your space, that might be great. There's typically different ways to deliver the sanitation product to those common touch items. And you might have specific populations that are too sensitive for you to be using pure bleach. So you might have to go with something that's more eco-friendly. So there's a lot of options out there. And really that's where a good consultant can help you get to the right product for your building, for your area. So as you do your HVAC and your sanitation, you start to make that building as safe as possible. Then we talk about exclusion. So really, it's simple. If you're sick, stay home. Don't come into work. If you are sick and you're a patron, you should not be coming in, whether it's a restaurant or a bank or any other interactions that require you to be close to other people. So you want your healthiest populations to be coming in. Distance, highly critical. We saw the 6 feet rule. That's standard across the CDC, across DHHS, even the World Health Organization has said 2 meters is ideal, 1 meter is okay. But really 6 feet is great. If you can get farther than 6 feet apart, like Matt said, that might require moving office spaces around, switching up cubicles, engineering that into the workplace so that people have that behavior built into how they function within an office. With that, you may have to define occupancy of different rooms. There's ways to do that effectively. There's signage that you can put up. But then you get into masks, and this is kind of the touchy subject that's out there. What kind of masks should you wear? Are they mandated by the state? Are they mandated by local guidance? And then should you mandate? And the answer is it depends. That's the typical epidemiologist answer is it depends. And then hand hygiene. So if you can make the building safe, exclude people that are sick, and then build in some distance and masks and hand hygiene, you've built a pretty darn good plan. And that's really what we have been trying to get to with all the places that we work with. And there's ways to operate between good and great, and we can help get you there. As I talked about, it really falls into 3 different areas. So you have engineering, you make your building safe, or as safe as reasonably possible. You have contingency plans for PPE. You may have defined risk people like medical personnel or people that work on facilities. You may have unknown risks. That's typically the majority of population. Those are the people wearing cloth face coverings. As you look at exclusion, really it's, if you're sick, don't come in, but you might have to have a business essential travel policy if you have sales teams that go out. You might have to have a critical worker policy, which the CDC does support, but there's ways to safely come in if you are a critical worker and you've tested positive for COVID and you do not have signs and symptoms. And then under administrative controls, it's really building in those behaviors so that people are screening themselves every day. They actively take 6 feet of distance as much as possible. They're wearing masks, but you might have to have family considerations, especially as schools that are shutting down or going into hybrid learning environments. But really making sure that you have good schedules, that you have ways to control crowds, and that you have ways to limit people in common spaces. We love to put in the military in me says everything should be green, yellow, red. Red being a high risk, but still safe within a COVID environment. It's just more risk. And then green, obviously, being the most conservative route that you can go. And this is really a spectrum of operations that are all safe. But if you have to go red in one category, for instance, HVAC, if you can't upgrade your filters because of the age of the system, you might be able to buy back some risk in other places so that you have different layers of protection that all work together to reduce risk significantly enough where you have a safe environment. An example, I love this slide. Your lowest risk is throw in HEPA filters. They're highly effective. They're pretty much the gold standard against COVID. Your moderate risk, you could go up to MERV 13 if you can get to it in your system, but there's more wear and tear on the system. Also acceptable is somewhere between MERV 8 and MERV 12. If you can upgrade to those numbers, that's great. Really upgrading your filter as much as possible, but then you can start adding in different things. So you can bypass that energy recovery, so you're not recirculating as much air. You can increase that fresh air intake. You can add standalone HEPA filtration units when you have those dense rooms. You can also augment with UV light. You can augment with ionization to purify the system, and you can run the system for longer periods. Once again, you can always open up doors and windows if it's safe and permitted by fire code.
And I think a good point here, Mike, for everyone to understand is that when you're looking across the big six for COVID, I think the answer here is that there's no one best approach, but there's multiple approaches that's going to give you different levels of safety. And what dictates what you use is you as a company, sometimes your budget, sometimes your culture, sometimes the physical limitations of even the building that you're in. And where in some areas like HVAC, you may be forced to be more in a yellow or red zone, it might mean that you're going to double down in sanitation and disinfectant and even have a little bit more spacing, maybe have a little bit less density within the office. So it really is the best approach is to have multiple paths in which you can address the big six. And you may have to move as time goes on because of things that happen within your building or things that happen outside your building with the disease profile.
All right, so sanitation and disinfection. As I said earlier, the EPA List N of pesticides that are effective against COVID-19, you can have up to 145 pages of products that are out there. So it's hard to find the right product, but making sure that whatever product you do select is available and you have redundancy in your supply chain so that you always have the same product. As you switch products, remember that you should have updated safety data sheets available for anybody using that product, just so that you clearly communicate what the hazards are and what the PPE is that's needed. But we've had a lot of questions about emerging technologies that are coming on the market. This is a specific comparative analysis from our industrial hygienist. And the question was, are UV hand wands that you can buy at Home Depot effective against COVID-19? So again, the answer is it depends. So if you think about the UV lights that are in a HVAC system, they can be as bright and intense as possible because there's no exposure. They're in a closed system. And typically people aren't going to get sunburned or have any adverse effects because it's all closed within the ductwork. As you get into the UV wands, that energy level drops, so you have to increase the amount of time with the light on a surface, but you also have to be closer to that surface. So it's not just setting up a light in the middle of a room, turn it on for a minute, and then you're done. But there's also disadvantages to it. So if there's a shadow, UV light is not getting to that area. If there's dirt on a surface, UV light is not penetrating to the bottom of that surface. So you still have to have clean surfaces. And our takeaway was, if you have to clean the surface anyway, you might as well just use a disinfectant at the same time.
And this is another example, again, of so much is coming from so many different outlets that it's hard to come up with the answer on a typical COVID-19 task force. You know, wands versus a typical spray. And yes, you can go to the EPA N list on your own and find products on there, but again, the application of them and the efficacy of them and how it works for specific situations isn't so easy to find sometimes.
Yep. So health screenings, once again, getting into that exclusion control. Health screenings are critical in building a behavior where people are effectively and constantly checking themselves out, reinforcing that healthy personal check. No, I don't have signs and symptoms. I have not had a fever. I haven't been around anybody who's been sick, and I haven't traveled internationally or been on a cruise ship in the last 14 days. So you can have two different options, or actually probably even more. But the main two are old school. You have a paper form. Somebody collects them, somebody screens them, somebody looks at them. So you get a little bit of admin Olympics in with that one. But you also have some free resources. We Protect Well. It's actually called Protect Well. It's a free service. It's a collaboration between Microsoft and United Health Group. And it's really focused at businesses. As long as you have employees that are over the age of 18 and adults that can check themselves out and sign the form, you can really get to a product where it's less labor intensive, less admin work on your side, and it's really as easy as looking at a computer screen and seeing all green. And the fact that it's free is great, but you may still need those health screening forms. If you have visitors or guests that are coming in, it is a great way to ensure that you can screen people effectively as they're entering the building.
We've had other scenarios when it comes to health screening as well with certain clients. We had a client that was probably a day or two away from ordering large tents to put in their parking lot to do health screenings before they realized that it was an unnecessary step to take. But another that bought how many dollars worth of those special thermometers, Mike, that that particular school purchased. And what kind of thermometers were they? They were the facial recognition.
Yep, there was a facial recognition feature, and it could scan multiple people at the same time, even if you're wearing a mask. And I want to say that it was probably in the order of $30,000 to $50,000 for 3 units.
Right. So you can avoid cost as well by just kind of having the proper level of guidance or information for sure.
But now if temperatures are required, they are set up to screen everybody as they're walking through the door. So as requirements change, you may have to flex. So sometimes being on the conservative side pays off, but sometimes it's not worth the investment. When we talked about distance, it's easy to say 6 feet, but how do you look at a floor plan and decide what is 6 feet or what you have to take offline, or are you even going to move stuff around? So there's ways to get to it. There's modifications that are required in some situations, and it might be as simple as using every other cubicle if you have a dense population. But once again, you might have to augment with increased HEPA filtration or mask use, depending on how close people are within those spaces and how much distance there is between people using the cubicle as a barrier. So is it more than 6 feet if I sneeze between my droplets and the next person? So those are things you have to think through. But an example is that picture that's right there. Mm-hmm. So face coverings. Like I said, there's a lot of controversy. People wear them differently, as you can see over here. Typically when I drive, I got the neck beard on. That's my favorite way to have augmented wear of that. But it ensures that I still have my mask ready so I can pull it up as needed. But really, as you're in management or within your peer group, just making sure people are wearing it correctly, because it's their health, but it's also an impact on you and everybody around that individual. So you really want to avoid gaiters. Not so much because they're ineffective, but there's a lot of pulling them up. They slip down, or they go over the ears and they become uncomfortable. So people the compliance with gaiters is a little iffy. Masks that have exhaust ports means that you are effectively breathing out. It's the same as not having a mask. Folded up scarves have gone out. Really, you want to make sure that the face coverings you have are at least 2-ply of cotton. If you can get to 3-ply cotton, that's good. If you can get to a combination mask where your outer layer is a synthetic material, your innermost layer is cotton, and then your middle layer is one of those two options. That's really what the World Health Organization has recommended and has set forward as their gold standard. It's all about the amount of stuff that mask is going to filter out. That's going to decrease that 6-foot bubble and really change the amount of transmission that happens. So remember that face covering stopped me, as I'm wearing my mask, from spreading COVID to other people. Like I said, it changes the amount of space needed between people. A face shield will not stop that SORS spread. A face shield will stop you from sneezing in my face. So there's different levels of protections, but the mask is still your number one go-to for stopping the spread. But if people want to wear N95s, just make sure that you have a HR policy in there that says this is voluntary use. It's not required. And these people have chosen to do this on their own, not because of a defined risk, but just for their own health and safety.
And one little tip, Mike, these are equivalent to how many layers of cotton?
Yeah, those, the surgical masks, the last I heard, they are, because of the static charge within them, they are effective as 27 layers of cotton or thereabout.
But one other part, you can only use them for about 8 to 10 hours worth of actual wear. So those ones you see with people that have stains all over them and they're starting to look shaggy because they've been wearing them for 3 weeks, they've kind of lost their efficacy already.
Yep. The big takeaway on hand hygiene is soap and water and sanitation has done more to extend the life expectancy of humans than any other medical breakthrough in the history of mankind. Washing your hands and having a clean area is the best thing that you can do to prevent most diseases. And so with that, just making sure that you reemphasize the times that you need to wash your hands with soap and water, but then making alcohol sanitizer available so that the easiest thing is washing and sanitizing your hands. And there's ways to place it. So I have some final thoughts. Really, it's that you cannot ever get to a zero COVID risk as long as COVID is in the environment. Not one of the solutions that we have talked about today is a perfect solution. They all have flaws. If you have the best HVAC system that's out there and somebody is still coughing right into your face and they have COVID, you might get COVID. But exposure does not need to equal disease. That's why we layer all of these different protective measures in there. So they all work together to reduce that risk. You're gonna have pre-symptomatic and you will have asymptomatic people that will walk through your doors. The number of those people is unknown really right now because we don't know the disease burden until we do 100% testing across the board, which we'll never get to. So we estimate, but we just make the assumption that those people will be there. And as you get sick, there's a big spectrum between I'm sick, and I'm recovered. And that spectrum is really, there's a new term out there called long haulers, and people that take weeks or months to fully recover, and they still are not back to 100%. Dwayne "The Rock" Johnson said it took him 3 weeks, and he is in better shape than I am, so I definitely do not want to get COVID. But as people go through this, as we get past that 200-day mark, as we near a 300-day mark, people are going to be complacent. They're going to be fatigued against all the different things that they've been asked to do. So really keeping up with your population and re-emphasizing those behaviors is critical. But the virus is not alive. It's not smart. It doesn't have a brain. It doesn't hate us. It doesn't love us. Really, it's just something that's in our environment right now. And we know ways to slow or mitigate the spread, but every single person has a job. So if we can all work together, and that's a responsibility of the building owner to make sure that the building is safe, And it's a responsibility of the people within the building to make sure that they have the best behaviors that are not putting other people at risk. That's really the job that we all have as we progress through this disease and hopefully beat it here in the next however many months.
We do have some questions, Mike, that came through, so I'm going to kind of fire some of them off. And obviously, if other people have questions still, feel free to type them in. One of them, the question was asked about if I am going to do a HVAC assessment, if I'm in a multi-tenant building, right? How do you handle that?
Yeah, that's a tricky one. That requires probably defining who is the owner of the HVAC system and who is going to pay for upgrades, and it might be a pooled resource thing. If you don't get 100% compliance and nobody wants to pitch in to upgrade the HVAC system to make the air as safe as possible, you may have to look at other options, and that could be HEPA filtration, that could be ionizing purification of your space, and really just investing in an effective mitigation strategy for your particular area, knowing that everybody else is not going to have the same risk tolerance for COVID as you.
Yeah, it's not uncommon with some of the clients we've had when they've brought us in, when we got to the HVAC piece, if they themselves weren't the landlord versus they were the tenant, it ends up being the landlord that we actually end up speaking with, as well as the HVAC vendor that's responsible for the HVAC for that particular company. Right?
The landlord that we end up.
Yeah, for sure. Another question here, Mike. What do you, if there's an outbreak in the building, but at a different company, what sort of precautions might happen if you're talking about a multi-tenant scenario?
Yeah, really, it's going to require coordination with Health and Human Services. They are the ones that own contact tracing. So Health and Human Services will do the investigation to see if there was an exposure within your space. And they'll look at where people live and work within that space. And they'll look at what is the HVAC system and what type of exposure was it. So was somebody just coughing, or were they just asymptomatic? Did they have masks on? There's a lot of things that go into contact tracing and determining who has been exposed. But really that investigation piece falls on Health and Human Services, and they will communicate with all the folks that have been exposed. So working with each other and working with HHS is going to be your best way forward in that scenario.
Okay. Couple questions in this this general topic. What if I have employees that travel, for example, sales team? Should I advise them to not travel to certain places or not come back to the office?
It's really dependent on your business model. There are requirements specifically in New Hampshire that if you travel outside of a certain area, you have to quarantine for 14 days. If you travel internationally or on cruise ships, once again, there's quarantine stuff that goes with it. So following the guidance that's out there, but defining your tolerance for having those salespeople out of the office is really going to be a business decision that has a COVID twist to it. So if you want to limit those sales interactions, you can. It might hurt your bottom line, but it protects your person. If you want to have those sales interactions, just re-emphasizing that lens. So 6 feet, 10 to 15 minutes. Wear a mask, wash your hands, just really pay attention to what's going on around you and make sure the people that you're interacting with are following the same protocols. That's going to be your best way of reducing risk.
I'm going to ask this question anyway, even though if you could answer it definitively, you may be a rich man. Will there be a spike this fall? Now, remember, the majority of the people on this call are in New England.
Yep. Yeah, I was just reading an article that compared last winter with COVID to what is projected this winter. And it doesn't look good. Remember that last winter, we did not have COVID entrenched in our society. We didn't have 7 million cases in the US. We had maybe a couple thousand as we got into February. You know, it wasn't as prevalent as you would expect. But this year we have 7 million cases as of, I don't know, a couple days ago in the US. And as the weather gets colder and people go inside, you have the chance to spread even more. So the projections were that it's going to be bad this year.
Okay.
And I agree with that. Really, it's going to fall on the ability of people to do the right thing, and how do you keep yourself safe, and how much do other people care about your safety? So are they wearing their masks? Are they keeping their distance?
Mm-hmm.
And as you think about the colder seasons, it's also higher travel. So you have Thanksgiving where you have family coming in from out of town. You have Christmas. You couple that with schools reopening. There's a potential there. So it requires more attention to what is going on.
What about multiple sites, companies that have sites in different locations and or different states? And how do you address conflicting requirements? How do you deal with that?
Yeah, I wouldn't call them conflicting requirements. I would call them the baselines. And so if I were an owner of a company and I had a few different businesses through a few different states, and one state has a mask mandate, I would probably put a mask mandate in all of my businesses. So if somebody has to come in, travel from Denver to DC to Manchester, it's always the same protocols. There's nothing different. There's no research. It's none of this, oh, I didn't know I needed a mask. It's, okay, cool, I'm here. I've got my mask on. Let's roll.
Okay. There was a question, we might have answered it already, asking about, do we need to wash masks, and can you wash a surgical mask?
Wow. Yes, you can wash masks. You can wash masks with soap and water. The CDC and all the guidance that's out there does not recommend using disinfectants on masks. So soap and water is going to be your number one. If you can dry it, that's great. So you use heat in a dryer to tumble dry. If you are in a hotel and you're traveling, once again, soap and water, and then you put the mask up on a drying rack. So you hang it so that it can dry effectively, and then you have a clean mask. Remember that if you take Lysol and you spray it on a mask, you're going to be breathing that in all day, and it's going to be like breathing a can of Lysol in, which is why we don't recommend using disinfectants on masks, because the toxic stuff in some of those sprays can get into your lungs, and it can cause you a different set of respiratory problems. And if I have very strict exclusion protocols and you're coughing and it's because of the Lysol that's on your mask, I'm not going to ask the question. I'm just going to say, go home, go see a doctor.
Last question, because we're at 5 minutes of.
Actually, I didn't answer both questions. The answer is no, you cannot wash a surgical mask.
Okay.
You wash them by throwing them away and getting a new one.
Yes. In the garbage, but do not put them in the...
in a garbage can, not on the street.
Yes, okay. What do you recommend if there are people that have cold or flu symptoms? What's the procedure? Do they have to quarantine for 14 days? What would a typical protocol look like for someone who actually does have those COVID symptoms when it comes to regards to when they can go back to the office?
Right. So the first thing that we always recommend is see a healthcare provider. Let them make the determination of, is it COVID or is it something else? From there, you follow the appropriate protocol. So for influenza, typically you're out for 3 days. You let your fever resolve 3 to 7 days. For COVID, you have to wait 10 days since symptom onset. You have to be 1 day fever-free, and your symptoms have to be improved. And the science behind that is because after about 10 days, there's not enough COVID left in your system to infect other people. And so that's why the 10-day rule is out there for people that were either infected with COVID and had signs and symptoms, or you went to a screening and you were asymptomatic and you tested positive. Once again, it's 10 days from the test, and that you would exclude from being in the general population.
All right.
And if you ever have a question, go see a doc, let them weigh in and let them make the determination.
All right, so just to wrap up, we appreciate the time that everybody gave us today. If anyone would be interested, obviously, in learning more about how we Fusion Cell could help your particular situation, just you have the email addresses here for Mike and myself, and you will get an email from us with the deck. But we could simply set up a discovery session, and it's usually done via Zoom, like most of the world right now. We walk into a little bit more detail on how the actual assessment works, but we also gain a lot more information about the scope of your particular business. Every one of these looks a little bit different. We've had clients that just need a couple hours of help and a couple checks and balances on the plans they already have. We have other clients that we've kind of built this from the ground up, including on-site visits and bringing different folks from our team in that have different types of expertise and so on and so forth. So we'd love to talk to anybody who's out there. And obviously anyone that you could refer over would be appreciated as well. But hopefully this gave you a little bit of baseline around why this is such a difficult puzzle to solve right now. It's because it is hard. It's because it is a bit of a moving target. And there's so much noise coming from so many different directions. And there's not one de facto kind of organization that's kind of setting the tone for this. Businesses have kind of been left on their own. But bottom line is, a lot of businesses are in that position where they need to have a place where employees can start to come back to get some level of normalcy. I think our point is with the COVID-6, there is a way to do that. It's not, it's the new normal, but there certainly are strategies out there that you can feel empowered to do so and have a workforce that feels pretty good about it. So we'd love to work with you if that's the opportunity is there. But otherwise, good luck and obviously stay safe.